Hello guys, welcome to the channel Health Tricks and Tips in English. In this video, I'm going to tell you what is amniotic sac or the gestational sac. What does it mean if it is not visible, or inside the gestational sac if the baby is not visible. Everything we are going to explore in this video. It is a very important video, so let's get started. First of all, let me tell you what is amniotic or the gestational sac. During your first 5 to 7 weeks of the pregnancy, the gestational sac or the amniotic sac develops inside the womb. It is a very thin membrane. It is just like a balloon, a very thin membrane, and inside it is the amniotic fluid. So it is also known as a bag that contains the amniotic fluid, and inside this amniotic fluid your baby will develop. In the initial stages, like 3 to 5th week of the pregnancy, it is a kind of a yolk. This baby is in the form of a yolk sac. So during your first ultrasound, which is commonly a transabdominal ultrasound, the doctor will try to analyze the presence of this gestational sac and the yolk sac. If they cannot find it, they will be performing another ultrasound that is known as transvaginal ultrasound, which will give a better or a clear picture of your uterus so as to see clearly or precisely the development of this amniotic sac and the yolk sac. This sac can be easily seen inside your uterus when the level of HCG is between 1500 to 2000. If in the first ultrasound, if your gestational sac or the amniotic sac or the yolk sac is missing, then you may need to have this ultrasound after few weeks again, and this may be because your HCG levels are not under the range that is required. So basically the reason of the absence of the gestational sac is, number one, you have performed this ultrasound prior to gaining the HCG level that is appropriate, that should be between 1500 to 2000, that guarantees that the amniotic sac will be there. Number second, this is the case of an ectopic pregnancy, wherein your HCG level will be higher, like it will be in between 1500 to 2000, but amniotic sac will not be visible. And this is because the embryo is not developing in your uterus but in the fallopian tube. Now again, this is a special case and your doctor will treat it specially. Number third reason could be that you have a very early miscarriage, and in this case your HCG levels will also be falling very rapidly. Now if your gestational sac is visible but the doctors cannot find the embryo or the developing yolk sac inside it, that should be visible within the 6th week of the pregnancy. If the yolk sac is missing or the embryo is not seen, then this is also again comes under the cases of the miscarriage. And these types of miscarriages are known as embryonic pregnancy, blighted ovum, or empty sac. They all clearly mean that the embryo has actually failed to develop inside the uterus. And this will usually happen in your first 3 months of the pregnancy, and there could be n number of the reasons, like it could be due to the poor quality of the male sperm or a poor quality female egg, or due to the abnormal cell division. So in this case of the chromosomal abnormalities, the woman's body will naturally miscarry this pregnancy. The women who are fortunate would see this developing amniotic sac and the developing embryo inside it when they will be performing their second ultrasound. But if this is not the case, it is always good to go by your doctor's decision. In these cases, if you are not satisfied with your doctor, the best thing you can do is to take a second opinion. You can select any other doctor or the gynecologist and take the second opinion. If the two opinions are same, that means you should go by what doctor is suggesting you. Hope you have liked this information. If you like it, kindly press the like button. If you are coming to the channel first time, consider subscribing, hit the notification bell and select all to never miss any updates from our channel. We will catch up in another video on pregnancy. Till then, peace out, stay happy, stay healthy.